Stomach cancer. Did you know that stomach cancer, while serious, is becoming more treatable thanks to ongoing research and advancements in medical care? Let's explore this complex disease, offering information, support, and a message of hope. Stomach cancer, also known as gastric cancer, begins when cells in the stomach grow uncontrollably. It can develop in any part of the stomach and spread to other organs. Early detection is crucial for successful treatment. The stomach plays a vital role in digesting food. Understanding its function helps us understand how cancer can disrupt this process. Knowing the basics empowers us to be proactive about our health. Global statistics, 2022. Approximately 970,000 new cases of stomach cancer were diagnosed worldwide, making it the fifth most common cancer globally. Stomach cancer accounted for about 660,000 deaths globally, ranking as the fourth leading cause of cancer-related mortality in 2022. East Asia bears a disproportionately high burden, with countries like China, Japan, and South Korea reporting the highest incidence rates. Notably, Mongolia has one of the highest age-standardized incidence rates, with 35.5 cases per 100,000 individuals. Many countries have observed a substantial decline in age-standardized death rates from stomach cancer over recent decades, attributed to improved prevention, early detection, and treatment strategies. There is an emerging concern regarding the rising incidence of stomach cancer among individuals under 50 years old, particularly in Western countries. This trend may be linked to dietary factors, obesity, and other lifestyle changes. Several factors can increase the risk of stomach cancer. A chronic infection with Helicobacter pylori bacteria can lead to inflammation and increase the risk of stomach cancer. Consuming large amounts of salty, smoked, pickled, processed, or preserved foods, especially those rich in nitrates, has been linked to gastric cancer. Diets lacking in fresh fruits and vegetables produce reduced protective antioxidants and fiber that help prevent cancer. Smokers are at significantly higher risk, especially for cancer in the upper part of the stomach near the esophagus. Heavy alcohol use irritates the stomach lining and increases cancer risk. Genetics can play a role. Having a first-degree relative with stomach cancer increases your risk. Surgeries, like partial gastrectomy, or conditions such as chronic gastritis or pernicious anemia can elevate risk. Obesity is specially linked with cancers of the upper stomach, gastroesophageal junction. It is most common in people over age 55 and more frequent in men than women. Prevention strategies include adopting a healthy diet like fresh fruits, vegetables, whole grains, and lean proteins. Limit salty, smoked, and pickled foods. Quit smoking to significantly lower your risk of many types of cancer, including stomach. And treating H. pylori infections through early diagnosis and antibiotic treatment to reduce inflammation and cancer risk. Limit or quit alcohol intake. Exercise regularly and eat healthily to manage obesity-related risks. If you have a family history or known risk factors, speak to your doctor about endoscopic screening. Regular checkups can help detect early signs. Avoid burnt or overly charred meat and practice good hygiene with food prep to reduce infection risk. Symptoms of stomach cancer can be vague and easily mistaken for other conditions. These may include persistent indigestion or heartburn, discomfort or burning after eating, dull stomach pain, bloating even after eating a small meal, unexplained weight loss and fatigue, feeling full after eating only a small amount of food, and anemia are all possible signs. Diagnosis typically involves an endoscopy, where a thin tube with a camera is inserted into the stomach. Biopsies are taken to confirm the presence of cancer cells. Imaging tests like CT scans help determine the extent of the disease. Treatment for stomach cancer depends on the stage and location of the cancer. Surgery, chemotherapy, and radiation therapy are common approaches. Targeted therapies and immunotherapy are also showing promise. Research is constantly leading to new and improved treatments. Clinical trials offer access to cutting-edge therapies. Personalized medicine, tailoring treatment to the individual's genetic makeup, is becoming increasingly important. Living with stomach cancer can be challenging, both physically and emotionally. Support groups and counseling can provide valuable assistance. Connecting with others who understand can make a significant difference. Numerous organizations offer resources for patients and their families. These include information about treatment options, financial assistance, and emotional support. Remember, you are not alone. While stomach cancer is a serious disease, advancements in treatment are improving outcomes. Early detection and access to quality care are key. Stay informed, advocate for your health, and never lose hope. Research continues to push the boundaries of what's possible. With ongoing efforts, we can look forward to a future with even more effective treatments and a better quality of life for those affected by stomach cancer. If you found this video helpful, please like, share, and subscribe for more informative content. Consider donating to cancer research or volunteering your time to support cancer patients. Together, we can make a difference in the fight against stomach cancer.